All right, good morning and welcome. Welcome to Tri-Cities webinar series. This morning we are going to be talking about co-occurring disorders and relapse. So we are so glad that you're here today, and hopefully this information will help you learn some things as well as build on things that you may already know. So to go over the time that we'll spend together this morning and things that you may need to know, just briefly, we are going to keep the cameras and microphones off during the webinar for all attendees. This webinar will be recorded and posted on the Tri-City website. If you have any questions, go ahead and type them as we go along. So they'll be in the Q&A box there. You should see that on your control panel. It should have a little file and say Q&A. So whenever your questions come up, go ahead and type them there. We'll save time at the end of the webinar for the Q&A, and we'll go ahead and read them and then answer them. And you can ask them to any of the panelists. For immediate support, we always want to remind you that you can call Tri-City at that number or the National Suicide Prevention Lifeline. And a survey should have popped up when you joined the webinar today, and we just want to ask you that you complete that survey before you close out today. So again, we thank you for being here with us today, and we hope that you find the time that you spend here today a benefit. So the things that we're going to talk about in regards to the co-occurring disorder and relapse today, we're going to cover some key terms. We're going to look at what the impact is of COVID-19 on co-occurring disorders. We're going to talk about the stages of change, and then the relapse process and recovery re-engagement. So how those things tie together. And then we're going to have a story of hope. So we are excited to share this information with you. It's been really great to work together. My partner Heather Cohen and I, who's going to go ahead and join us in just a minute. And anyway, so we're really excited to bring this information to you. So let's look at some of these key terms. When we look at how we define a mental health condition, it's a brain disorder that leads to a set of symptoms. These symptoms have to do with regulating a person's thoughts, feelings, and actions. And they include symptoms that interfere with the person's ability to perform daily life functions. When we look at defining substance abuse, we're talking about alcohol and/or drug use that's characterized by a couple of different things. One is a loss of control, one is progression, and another is an inability to predict with any certainty what will happen once a person takes that first drink or picks up that drug. Continuing with the key terms, when we talk about recovery, we're talking about learning and using strategies such as medication, counseling, motivational enhancement, 12-step recovery meetings, skills training, and other strategies to move from illness to wellness. So you can see that gradient there where a person would go from being in crisis to being unsettled and then into thriving and excelling. When we talk about relapse, we're talking about a person who has a reoccurrence of symptoms after a period of recovery and may return to a previous state of being unwell. And sometimes if you're not a person who's in recovery from mental health or substance abuse, we all know what recovery and relapse are. If you think even just about a cold, when you've had a severe cold and you've done things to get better, right? You then are in recovery from your cold. You're moving towards wellness. And if you have a reoccurrence of symptoms with that cold, it's the same thing as a relapse, right? So those definitions are common for all of us, just in different areas, even if we aren't in recovery from mental health or substance abuse. So I am going to have Heather join us now. And
okay,
over to Heather.
Yes. And so my video is not able to start until
I gotcha.
You got it? Okay. So what we would like to do is share there we go. Hello. What we would like to do is share a video on the stages of change briefly, and then afterwards we'll discuss it.
The trans-theoretical model also
Let's try that again.
The trans-theoretical model, also known as the stages of change, represents a person's readiness to change. There's 6 stages. These are pre-contemplation, contemplation, preparation, action, maintenance, and relapse and lapse. Today, we'll look at the model in the context of alcohol and other drug use. Identifying where a person might be at in the change process can provide some direction as to how they can best be supported. Let's take a closer look. Pre-contemplation. People in this stage aren't worried about their use. They're not interested in stopping or cutting back. Even though other people might be concerned about their use, for them the benefits far outweigh the consequences. Contemplation. People in this stage of change still enjoy using. However, maybe they're starting to notice some problems from their use. They're weighing up what changing might mean for them. Preparation. This is when the not so good things about using are starting to outweigh the things they enjoy about it, and they begin preparing to make a change to their use. Action. They've started to make changes to their alcohol or drug use. It will depend on the person's goal, but this might include things like using less or stopping. Maintenance.
Don't know why we're having difficulty with this.
The trans-theoretical model, also known as the stages of change, represents Identifying where a person might be at in the change process can provide some direction as to how they can best be supported. Let's take a closer look. Pre-contemplation. People in this stage aren't worried about their use. They're not interested in stopping or cutting back. Even though other people might be concerned about their use, for them the benefits far outweigh the consequences. Contemplation. People in this stage of change still enjoy using. However, maybe they're starting to notice some problems from their use. They're weighing up what changing might mean for them. Preparation. This is when the not so good things about using are starting to outweigh the things they enjoy about it, and they begin preparing to make a change to their use. Action. They've started to make changes to their alcohol or drug use. It will depend on the person's goal, but this might include things like using less or stopping. Maintenance. They're maintaining this change. They've been in the action stage for long enough that change has become easy. They've got this. They're no longer dealing with constant cravings and triggers and have maintained their goal for a significant period. Relapse or lapse. A relapse is a return back to using, and a lapse is a slip-up. A lapse does not automatically lead to a relapse. Both lapses and relapses provide an opportunity for the person to learn more about themselves, what triggers them or challenges them, and what promotes opportunities for growth. It's really important to help the person see any lapse or relapse as a learning opportunity as opposed to a failure. People learn a lot more from their setbacks than from their successes. And that's the stages of change, or as it's known as in technical terms, the trans-theoretical model.
So when we look at the stages of change, there's some common contributing factors for relapse, depending on where someone is at in their process. In the preparation stage, maybe a person was rushed without developing a solid plan. And we need to go back to a previous slide. So we've kind of rushed ahead. So the other thing that I wanted to point out in the previous slide is that in the maintenance stage, overconfidence could lead to not adequately tapping into your coping skills and your support system. And sometimes the best way a loved one can provide support is recognizing and meeting someone right where they're at. In the pre-contemplation stage, it can be as simple as not protecting your loved one from their own negative consequences. It can also mean for the therapist or the support member, not rushing a person through the preparation stage, because a solid plan and preparation is required to have success in maintaining your abstinence or your recovery later. So now we're at this slide discussing the real and potential impact of COVID-19. And we can see that currently what is known in regards to the substance abuse in the country and how it's changed during this pandemic is that alcohol sales have gone up 55%. We don't know if that is because people were stockpiling to get ready through the shelter at home restrictions, or if it actually means a true increase in spike in use. We also know that pornography has gone up 22%. And the reason that I include that is because pornography can be addictive for some people. And usually, typically, pornography use will go down when the economy's gone down or when there's been job loss. But the fact that we're seeing it now leads some people to speculate that it could be because the people are isolated, they've lost their job, they've lost that sense of purpose and that structure. And so they're reaching out and using other forms of outlets to cope and to survive. In terms of mental health during this pandemic, we can definitely see where things have gone up in stress and anxiety, job loss, the fear of disease, facing the unknown. And we also know that the social support access has greatly been reduced. For those people who are in recovery, for those people who have appointments with mental health or their support system, they don't have access to meet in person. And then we come to facing the unknown. We don't really know quite yet, and we can only speculate how this is impacting people who have a history of substance abuse. We don't know if it necessarily is going to lead to an increase in relapse, but we can look historically that substance use has increased after major disaster, like we saw after Hurricane Katrina. And for some, substance use is a way of coping. We also know that suicide rates increase historically. During the Great Recession of 2007, we saw suicide rates increased 1.6% every time the unemployment rate raised 1 point. And we've seen even currently a spike of suicides in specific regions such as Pima, Arizona, where in the past 2 months, they've had 23 people commit suicide. At one point, it was 15 suicides in as little as 14 days in that region. We have learned in a dual diagnosis that the recovery of one area in life greatly impacts the other. So it's really important in any form of recovery that you're taking care of your mental health as well as fully taking care of your substance use program. After careful study over the years, experts have learned there seems to be a general process for relapse. It usually starts with an overwhelming challenge. Let me see if we can get this slide to give us the pop-ups that we're looking for. Let me see. This slide doesn't seem to be cooperating with me today. Okay, there we go. So the relapse process starts with an overwhelming challenge. Some refer to it as a high-risk situation. Person doesn't have a healthy way to deal with that. And if it's coupled without the right coping skills, a person loses their sense of self-confidence. We call that self-efficacy. When a challenge is coupled with a loss of self-efficacy or your confidence to cope or handle the challenge occurs, you begin to resume old habits, or that old way of life can start becoming appealing again. And then you might act on some of those thoughts, which would lead to a relapse or a return of your symptoms. The opposite is also true, that the longer a person can maintain abstinence through healthy coping skills, the sense of self-control and confidence goes way up. So if a relapse is experienced, a person reaches a crossroads to either give way to those feelings of guilt and failure or to return to their coping skills and rebuild their sense of confidence or self-efficacy to handle those overwhelming challenges. So I'm going to ask the host to help me move to the next slide. It's important to know the size of the overwhelming challenge doesn't matter. That's because the interpretation of a challenge is subjective. Challenges come in many faces. What's challenging to you today, as you can see, may not even be challenging to you tomorrow. What makes a challenge high risk or overwhelming depends on your resiliency to meet it. It depends on where you're at in your recovery and your health, on whether you have that sense of self-control and positive use of coping skills to meet those challenges. Just as there are stages to change, there's stages to relapse. In relapse, before one ever meets the overwhelming challenge, there was probably an emotional or mental relapse that happened before. So remember when we said that the size of the challenge doesn't matter? There can also be a culmination of small challenges along the way in your journey that can overwhelm your sense of self-control. How does a small ant overtake an elephant? He overtakes it by swarming the elephant's vulnerable points to where it can't function. And in our case, a lack of self-care makes us vulnerable to those stressors in life. So that's what we mean when we say someone's facing an emotional relapse or a mental relapse before they ever take that initial step to pick up and use or to go back to an unhealthy way of life or an old habit. So this list of emotional relapse isn't exhaustive, but it can show you where there's some similarities in substance abuse and in your mental health. One of the most common similarities is denial. Sometimes we can stop being honest with ourselves, or we can stop being honest with our support members. When we stop asking for help and we start reaching out, we might isolate and not make ourselves available to ask for help or to receive feedback. The same can be said of a mental relapse. So you can see here, common early warning signs can be romanticizing the old days in your substance abuse or glamorizing the past highs and lows in your mental health. When you weren't practicing consistent self-care, we might begin to lie to our loved ones and our family members, or we might begin to just diminish the report and say, no, I'm fine, nothing's wrong, everything's okay. When we come to the bottom line, I like to call it the whatevers. You could also call it it's a loss of motivation. It'll start looking like thoughts of, well, it doesn't really matter anyways, does it? Is this really even going to make a difference? Sometimes in recovery, we have many different colorful words that we use to just say, screw it. Doesn't matter. If you can't beat them, join them. When you start having those thoughts, it might be an early warning sign that you're moving into an unhealthy, unsafe place of coping, where that next challenge could be the very thing that hits a blind spot. The key to your recovery is knowing your strengths, knowing your coping skills, and knowing your early warning signs, and including your support members in that. So you can develop a plan to reduce your risk for relapse and a plan to return if you do experience a lapse. So we want to welcome our guest next to share her story, recovery.
So we want to also encourage you at this point to go ahead and put any questions that you have in the Q&A box. Anything that has to do with the stages of change, the relapse process, the interconnectedness between mental health recovery and substance abuse recovery, and some of the images that we showed around that. If there's anything that brought up or any gaps or anything that you have in that, please feel free to write those questions in the Q&A, and we will get to those in a few minutes. So it is my pleasure to bring our guest in to share her personal experience with us. And this is Karen Brubaker, and she is one of the, I would say, bright spots of a shining star, of somebody who is in recovery with dual diagnosis, both a substance abuse and a mental health condition. And I've been able to watch this season of growth for her, which has really been a treat for me. As her and I were preparing for the webinar today, we were actually looking back a little bit on some of the moments that I've seen transform for her. And it was really kind of cool to remember some of those markers for her. So I'm very, very proud today to bring Karen in with us. I also want you to think about any questions you have for Karen. So you're going to be able in the Q&A to ask us questions for me, for Heather, and for Karen. So as you're listening, listen with a questioning ear, and you'll be able to ask any questions that you have. So at this point, Karen, would you mind sharing with us a little bit about your journey in recovery that would help us understand this connectedness in co-occurring disorders?
Absolutely. Do you want me to read the story?
That'd be great.
Yeah. 5 years ago, I had my first mental breakdown. This event occurred while I was abusing prescription medication. After being hospitalized for my breakdown, I was diagnosed with schizoaffective disorder. The symptoms included delusions, hallucinations, depression, and somatic behaviors. These symptoms caused me to become paranoid. My paranoia led me to believe that people were following me and talking about me constantly. The hallucinations I experienced involved the characters on the television talking directly to me, as well as my deceased father appearing in my house. Once returning to a lucid state, I still did not realize I had experienced a mental breakdown and was suffering from a mental illness. After the experience was over, my relationships became strained with my friends and family. They became strained due to the past events with substance abuse and a new diagnosis of schizoaffective disorder. Unfortunately, Alcoholics Anonymous showed stigma in regards to my mental illness when I would share about my experiences. Later, I realized it wasn't the overall opinion of the group, just a select few. Participating in Tri-Cities medical services was the moment of my turning point in both my mental health and my substance abuse. My therapist was my sole support system when I first began with Tri-City. Grounding and coping skills were given to me when I became anxious. My psychiatrist prescribed injections to help me stabilize my condition. With the various groups at Tri-City has helped me to express my emotional state to people with similar circumstances. Their services helped me to understand that my illness can be controlled, and that gave me hope. My recovery from active addiction resembles my mental illness. In order for me to remain sober, I attend regular meetings with people that have similar issues, as well as a sponsor who helps with the 12-step program. The interactions with my sponsor is similar to attending sessions with my therapist. Staying sober requires dedication and maintaining a healthy lifestyle. Unfortunately, if I were to abuse drugs, it would greatly affect my mental health and vice versa. There has to be a balance between my substance abuse and my diagnosis of schizoaffective disorder. I can assure you, the longer you work at it, the easier it gets to maintain a sense of normalcy. In the 12-step program, sharing issues of mental illness creates stigma from the groups due to fear or a lack of knowledge. However, I continue to share my experience with mental illness in hopes that others will feel comfortable sharing their stories. Currently, I no longer require injections to keep my mental illness stable. The coping techniques I have learned from my therapist keep me in better control of my anxiety. I have a better relationship with my family and friends today, and I am able to enjoy activities with my loved ones, and I can enjoy life once again. Thank you.
Look at that smile. I love it. I love it. So a couple of questions. Can you share with us what would be called like your bottom with your alcohol and drug use, how you ended up in a 12-step program the first time, and a little bit about that part of your life?
Absolutely. My first addiction, my first love was alcohol. And what happened is it progressed very quickly with my alcoholism. The drinking increased dramatically within a year to 2 years. It caused detrimental consequences, several drinking and driving, hardship within the marriage, hardship within the family. And that's when I decided to go ahead and try Alcoholics Anonymous. Now, Alcoholics Anonymous, I have not had a drink in 20 years. That's how long I've been going to meetings. But unfortunately, I was able to stay sober for 7 years, and then I injured myself. With that injury came the prescription medication, and I found out very quickly how taking enough of it would give me the exact same effects of alcohol. And so that, with the prescription medication, I've been struggling off and on with that for about 10, 12 years in the program. And I believe that, I know that the program, the 12-step program worked. That's why I continued to come back. Whether I was loaded or not loaded, I would continue to show up in the meetings because I knew it'd help eventually. But what it led to with continual abuse of the substances, it led, I believe, to the nervous breakdown that I had, the mental illness. Yeah.
Yeah. Thank you so much for that. I think that embodiment of the keep coming back is so valuable, but it's difficult, and a lot of people don't keep coming back. So I'm really grateful that you did, no matter what, because you've found that balance now. What about you touched a little bit on the similarities between how you manage your recovery, or the things that work, I guess, for both your mental health and your substance abuse recovery. But are there things that are different, things that you need to do and watch for in your substance abuse versus things that work and that you need to do and be actively looking for in your mental health journey? Are there things that are different?
There are things that are different. A lot of things very similar as well with the therapist and a sponsor. Those are very similar. The difference, I believe, with the substance abuse is it requires a lot more effort and a lot more time. It's very important, especially in early sobriety, is to make sure you can attend several meetings a week. So in that regard, it's unlike the mental health. The mental health, you can see your therapist once a week. You feel better. Maybe you take medicine, as like I did. But the majority of Alcoholics Anonymous or any 12-step program, you have to keep coming back in order for it to sink in. That's what I found with my experience. And also, you're doing a lot more details in the 12 steps on your past and your lives and forgiveness of yourself. For me, that's where the similarities came in. As I was doing the steps, I was able to explain to my therapist the different stages I was in. And it was also a freeing, it made me feel free to be able to explain it in that setting as well. Because the therapist had different takes, per se, than Alcoholics Anonymous or the members of the 12-step program. So I believe it was greatly beneficial.
Yeah, I think that's a beautiful way to put it, that it sounds like being active in working the 12 steps with a sponsor, that you were able to trust your therapist and open up more and transfer that vulnerability into that relationship as well.
Correct.
That's amazing. And then that allowed for this other perspective to come in on the parts of your mental health condition that needed that support. I think that's a beautiful accompaniment that, like I said, is just such an example of what co-occurring recovery looks like. So let's touch on this, because I also think that this is such a beautiful part of your story. Can you share with us a little bit about how, what your life looked like prior to your spiral in regards to employment and your contribution to society, and what happened, and then what your transition has been like now and where you see yourself?
Absolutely. I've been employed since I was employed since I was 16 years old. I was in food and beverage. I learned to, how would I say it? I was managing country clubs. In the country club setting, it's a golf course, and along with golfing goes a lot of drinking. So when I was working those in my 20s and thereafter, drinking was acceptable in the workplace when you got off work. I also proceeded to purchase my own restaurant. So I was very, very active as far as my employment, if you want to say active. But when I had the nervous breakdown 5 years ago, I was currently employed at that time, but the money wasn't as good as I was used to. My living situation wasn't as good as it used to be. the substance abuse started reoccurring more often, and I ended up losing everything. I lost my job. I lost my mind. It was very scary when I had that nervous breakdown. Everything changed. And so the coming back from that has been a long journey, and it's been a long process. It's well worth the fight, absolutely, because right before the COVID thing, I was able to have a job interview, and I was able to start looking forward to employment all over again. So it is possible to come to reality.
Yeah. And I think that that's one of the parts that I've been able to see transform in you, is that employability piece, and seeing you become ready for that, and seeing you build that confidence and that self-efficacy where you can see yourself as being a worker again, and having something, not only having something to contribute, but being able to sustain employment. And I think that that's just really, really cool to see you at that part of your recovery. One of the other things, so both pieces of recovery strengthen when you find ways to give back, right? And actually is part of relapse prevention, right? 12-step calls it service, and mental health may call it more finding purpose or finding meaning, right? And either way, whatever you call it, it's the same thing, right? And it does the same thing for your soul. So can you talk a little bit about that and how you've found purpose, meaning, and or ways to be of service that have helped you prevent relapse?
Absolutely. In the 12-step community, I'm able to be of service by talking to people. I'm not to the sponsor stage yet, because I still have my 9th step to go, and 9, 10, 11, 12. But you can give back in that setting. You can give back in so many different ways. Just a phone call helps with the substance abuse, and it keeps you out of yourself, as well as you get to help somebody else possibly. In the mental setting, for my mental health, Tri-City has wonderful programs that you guys offer. I've been able to dial in on a lot of those different programs. And actually, I had wanted to do peer mentoring and was turned down. And last year, I was actually accepted to do it. And so it's been great learning how to get back in the mental community as well. Absolutely.
And what, for those who don't know or aren't familiar with peer mentoring, what is that, and what do you do?
Actually, it allows me to help other people in the community that might be struggling on a different level. Most of it's active listening and just being that support for that individual that might be struggling.
Mm-hmm. And then you're also a part of the community of other mentees, right? Other
Correct.
People who have mentors. So
yes.
You and the other mentors have a community. You guys know each other. You see each other regularly. And
it's another support system.
You support each other. And then how many mentees do you have right now?
Currently, I have 5.
Whew! Karen, you have like a caseload. And so has that grown because of COVID?
Yes, it has. Due to the COVID, there's been more that maybe don't need the every week phone calls, but just every other week to touch bases to make sure that, if there's anything I can help them with, or just to speak to somebody. Yeah.
Yeah. So good. And Tri-City appreciates the adjunct support that peer mentors provide. It's such a valuable, valuable service to community members. So we applaud that. The other way that you've really been able to give back and to find some meaning, I always say, with some of the darkest moments and bring hope and light to those, is sharing your story.
Yes.
Right?
Absolutely.
So
Yeah.
you've had the chance to do that through our Courageous Minds program.
Absolutely.
Can you talk a little bit about how taking your story and putting it into words from a mental health perspective, and then sharing that, what that's been like for you?
It was difficult to put it down in words, because when I start recalling all the different incidents that happened to me with the breakdowns that I've had, it's kind of scary when you get it out on paper. But the other thing that's been beneficial by having it out on paper, I am able to read it to my family, and they have a better understanding of me just trying to talk to them and communicate with them. When if they listen to me reading it, they have a little better understanding of what I deal with. So that's
amazing. So it helped you share your story in a whole new way for the first time with your family.
Absolutely. Yeah.
I love it. I love it. And again, we appreciate that aspect of giving, because it allows Tri-City to be in the community in ways that people's hearts and minds open up and change.
Yes.
Because stigma is real, and stigma keeps people from getting well. And when people like you can come out of the shadows and boldly and proudly share your experience, knowing that there is light and hope, then others get to see that they too can find help and maybe find some hope in their own life or in the life of someone that they love and care about. So and I always tell you guys that you do more for that than I can with some slides in a presentation. Your stories are such a strength and asset to the community and our stigma reduction program. So for that, we thank you as well. I think that we have some time to go to the Q&A. If everyone's ready for that, we can bring Heather's camera back on. There we go. Jessica, do you want to help us out with the questions?
Yes, our first question is how to navigate when needing the help. Difficulty in trying to access the online AA meetings. This may be difficult for someone that has a dual diagnosis.
Yeah, how about you maybe start with that, Karen? Have you been doing 12-step meetings online right now, and what has your experience been with that?
I have been doing meetings online. It is very different. It's not the same as being there, obviously, with your support system right in front of you. I have mixed emotions on them. Some of them I enjoy and I can tolerate, and others not so much. But it's the same as if I was going to a meeting anywhere. But there are some glitches that happen that make it more difficult to talk and to stay for the whole hour meeting, because a lot of people will come in and then they just bow out. Yeah. So it's absolutely been a struggle. Yeah. I think most of my interactions has to be via phone at this time.
That's really good input. So maybe even conference calls with friends, or I know that before Zoom, before 12-step meetings were really going with Zoom and they were listed everywhere, some friends and I were doing Facebook chats on Facebook videos. So you can add several people to that and everyone can see each other. So if someone wants a closed experience with just people that they know, that's always an option. One of the things that I've heard is people with anxiety and who have difficulty sharing at meetings, surprisingly, in a format like this, have an increased anxiety and difficult sharing, where for me, my head says, well, this is a lot easier. You're not in the room with people. You could actually put your screen where you don't have to see other people. You can make it like a candlelight meeting, you know, and like turn videos off. So for me to hear people express that was surprising but understandable. And so I think that maybe speaks to what the question was saying as well. One of the things is that on all meetings, there's also the dial-in numbers. So there's the option of just calling and not doing the video component of it, just using your phone and being able to do the audio. So that's always, I think, an option as well. You want to do the next question, or did you have anything to include with that, Heather?
I think I would add that technology is really difficult to navigate through. You could even see in our web seminar right here today, we experienced technological challenges. It's going to happen. And so that can increase somebody's anxiety and stress. And they can also increase that fear of, I don't even know how to get on, so I'm not going to try. And so sometimes it helps being brave enough to just say to your support system, hey, I really need help on this because I really need this tool. And so recently, I have gone to somebody's house that I helped who does not know technology, and I just walk them through the steps. So if you could find someone that you trust, you could find someone who's willing to take the time, that includes even your therapist, to ask for a video conference call and say, hey, can we share a screen? And can we explore this and walk through this together so that I can set up my computer or I can set up my cell phone to go to these links and these websites in the future on my own, because I know it's a tool and I know that I'm going to need it.
I love that. So good, Heather. All right, next question, Jessica.
The next question is it common for someone in recovery to lie about achieving goals? It says to say they are involved in healthy activities and helping others when they are not.
Oh.
Say that could happen. I don't know if we're judging it as something that's common and that's something that we should be looking for as therapists or sponsors, but we're always aware that it can happen where somebody can underreport their severity, underreport their needs, and try to keep a stiff upper lip and put on that face and say that everything's fine. And I think also what can happen is we can diminish where we're really struggling.
Mm-hmm.
And that could happen for many reasons too. We don't want to be a burden. We're wrestling in our mind, well, maybe it's just not that bad. I don't want to be needy. I think it's just accepting a person where they're at and taking the time to get to know them where they're at. And if that comes up eventually and comes to the surface, I think it's really important to be patient and to be willing to sit down and take the time to explore with that person what that was for them, what that was about, and feeling that they had to hold that truth back.
Mm-hmm. Yeah, and I think that you touched on it on a couple of the slides, Heather, as part of the relapse process, that somebody may not be honest with themselves or honest with their support system. And that kind of behavior and thinking that, oh, I can't tell people this, or, oh, I have to pretend to be something other than I am, or be somewhere other than I am in my process, can be part of setting themselves up for a slippery slope for that lapse or relapse in recovery. And I think that there are, as you were saying, a lot of things that can contribute to that. And so not to judge it, but to see that it's a natural thing when we're in a position where we're trying to trust people with very intimate, personal parts of our life, and where our ego is fighting against us sometimes, because in order to be intimate and open, you have to put your ego down, your defenses down, and your ego is always trying to pop up and block you from that intimate personal connection with others so that you can be safe and not hurt, right? Because there's that potential for hurt and pain and vulnerability. And so that ego can sometimes have us say things that aren't true, have us trying to be that chameleon or look better than we are when we're struggling. So I think that that can definitely play a part too. Feeling inferior and then thinking that the other person, I want them to view me a certain way, can also have me saying that I'm doing things or that things are better than they are. So it's not to judge yourself if that's happening. It's I wouldn't say common. I would say understandable and risky, but definitely understandable. So nothing that you can't say, oh my gosh, I kind of feel like a jerk. I've been so worried about what you think about me that I haven't been honest. And I think sometimes it can be as simple as that.
And I think as a support member at that time, it's really important to go really slow and explore that with that person and not gloss over it, so that you can both understand what were the contributing factors, what were the emotional relapses or the mental relapses at play in that, so that we can develop a stronger plan in the future. Where was your area of weakness that you didn't feel like you could be really open about that, where you were at?
So good. All right, Jessica, next question.
The next question is, how can clients obtain assistance without the proper technology?
So assistance with, well, I guess if we're saying both 12-step and mental health support, if they don't have camera capability, meaning a laptop, a tablet, or a phone that has camera capability, a phone with just a phone number can call in to 12-step meetings, as I was saying. And I think just to note quickly, one of the things Karen mentioned was the stigma in 12-step recovery. And one of the things that is suggested is go to enough meetings, enough different meetings to find one that feels safe and comfortable. So now that we're in this technology-based service delivery, this technology-based connection with 12-step meetings, it's the same thing. Go to a couple different ones, dial into a couple different ones until, as Karen was saying, you find one that kind of feels comfortable and that you want to keep coming back to. As far as if you don't even have a phone, Tri-Cities Wellness Center is open. There's limited people allowed at a time, obviously, for social distancing and for safety. But if you walked in there, you would be able to connect and find out what you could do. Someone would talk to you and help you. Also, Tri-Cities outpatient services are open, and you could walk in there, you could call and set up for services there to be able to walk in and talk to somebody. So there's still in-person services available for mental health. And I know that for 12-step, there are in-person meetings that are still happening in social distancing. A lot of them are outside meetings. So if somebody knows of a meeting that's at a park, or that's outside, they're oftentimes using chairs, like park chair, camp chairs, baseball chairs, and just social distancing and still meeting outside. So I think that it's available. It's just not as obvious and not as ample. Anything else that you guys would add to that?
I think that's good. I think that pretty much covers multiple ways of tapping into support.
Karen's laughing. Do we have another
The
question?
next question is, what can I do to help someone who is in pre-contemplation?
I think that's a really good question, because I think we have a tendency, if we're a loved one or if we are therapists or we are sponsors, is to try to rush that stage because
So
we're ready for our loved one.
Heather, can you refresh what that pre-contemplation is in just a sentence?
Oh, sure. Pre-contemplation is where somebody may be using or somebody may be in a lifestyle that is unhealthy and self-sabotaging, and they're not thinking of changing. They are happy as they are, and they're not really in touch with any kind of consequences, any negative consequences for those unhealthy life choices. So they're just going about their day and thinking life is fine and not considering change. And I think when we encounter loved ones or people that we genuinely care about in the pre-contemplation stage, we're experiencing the anxiety and the discomfort of that because we're seeing where it could possibly lead, and they're not looking at that. Our family member or our loved one is not looking at that. And so what we have a tendency to do is to apply pressure, and that gets really unhealthy and codependent. Or we attempt to rush that person through masked threats, ultimatums, I mean it, or to just rush through in contriving consequences that aren't really felt or really personal to that person, because we want to alleviate our anxiety. And so when we find somebody in the pre-contemplation stage, it's really, really good to go and step back and take an inventory within ourselves of what's coming up for ourselves and put that in check so that we can keep the focus on meeting that person where they are at and accepting that they are not considering change. So being able to sit and be fully present with that person in a non-judgmental stance and really hear their story, hear where they're at, and just reflect back to them where they're at so that they can begin to see for themselves and make sense of where they are in their journey. And then another really important stage is that we don't enable and we don't protect someone from the natural consequences that truly belong to their choices, so that we don't want to be a rescuer.
So good. Good points. I love it. So I think, have we covered all of the questions, Jessica? Is there one more?
I think all of them are answers. Someone just put motivational interviewing question mark. I'm not sure they're
Yeah, absolutely. So those stages of change are the core of motivational interviewing and how to process through those stages of change. It's definitely a huge part of it. So I want to come back really quick so that everybody has these resources that are available. So here are some services that are available to help you. We have our community navigators. They have information, linkage, and referral for local resources, including food, medical, legal, mental health services, senior supports, and a bunch of other things. So if you are looking for anything, they will help you. Things look very different right now with the quarantine, but we're in a phase of transitioning, right? So please call them if you are looking for any support. They may be able to help you with that. And then we have a well-being supportive chat through that you can access and talk to Chris Anzalone, and he will figure out the best path and avenue for you to access support through Tri-City. And then if you need crisis support, Tri-City has a supplemental crisis support line, and you can always contact us at any time, even if you're not someone with a therapist or services set up through Tri-City, you can always contact Tri-City in a crisis. And then this is mine and Heather's contact information if you need to stay in touch with us for any reason, as well as the follow-up information for additional webinars. Our community conversations are on Thursday from 1 to 2 p.m. So please join us then. This week, our community connection is on telling your story as part of your recovery journey. So please join us Thursday for that. And then every Tuesday, we have a webinar at 11 a.m. So you can find the list of webinar topics at the Tri-City website on the calendar, and you can scroll down or click on the COVID resources, and the calendar then will be in the right-hand margin. So again, we are so thankful that you joined us today. Please make sure to fill out the survey as you leave, and we are thankful for your support as always. So we will hang out for just a minute as people exit, and then we will close the meeting.